Hey, everybody. It's Kevin, it's Zane, it's Chris, and we are on the exciting episode of the Healthcare Tech Show talking drugs by drone and printer. And so today, there's a lot of interesting things in the news. We want to jump into what Amazon potentially has cooking up, and I'm sure others will follow when it comes to drones. And we'll take a little bit of time to also talk about some 3D printing stuff that is right around the corner. Talk to you in a sec. Zane, Chris, I've missed you guys. How have you been? What's been new? We'll start with you first, Chris. What's been going on, man?
Not too much, just still getting a little bit better every day at dad life, right? So, but I definitely miss you guys too the past 2 weeks. So glad to be
Amazing.
back.
Amazing. Zane, what about you, buddy?
I just, no, nothing really. I've just been chilling. That's about
Just
it.
been, and I do love it's a bird, it's a plane, it's an RX. Yeah, it's that's legit right there. We'll be putting the bat signals up and the Superman signs here very soon for Amazon to drop off at our house. So really curious. I'll just flash the picture over for general visual review. But yeah, Amazon is doing some interesting things. I remember that we talked previously, and I was really interested in a few different applications of leveraging drones in particular for healthcare when they were talking about AED units, right? Getting those out into rural locations where potentially an ambulance wouldn't be able to get out there as quickly, or in other locations that are like unrelated to roads. So you've got recreational areas and stuff like that. But haven't talked or thought a whole lot about drug delivery via drone. We knew pizzas were happening via like self-piloted cars. And I thought that would be the next like step that we potentially see in a kiosk form. But now seeing drones potentially delivering drugs to your doorstep. Zane, what are your thoughts, man, on everything overall when it comes to this kind of delivery mechanism? And let's start with the positives. What kind of things do you think this will really open up when it comes to health equity and access to meds?
Exactly what you said. I think I think we forget, at least us most of us that we know, like, we have access to cars, vehicles, easy transportation. I think one thing that's overlooked quite often is, we tell patients to get to appointments or pick up meds or do all these things, but life happens. So this kind of I shouldn't say solves the issue, but it kind of helps solve the issue of, you might not have a car. You might be an older, lady who is bedridden or, can't leave her house. So, it's delivered right to you on demand, right? I mean, I know there's mail order pharmacies and this and that. This is more so like for your local pharmacy down the street, right? But yeah, I think that's the biggest draw to it.
No, I totally agree. I mean, and Chris, I'm thinking, you get discharged from the hospital and it's like, oh no, now the next thing I have to do is stop off at the pharmacy to grab my drugs. And the fact that you could have them just delivered to your door is a really interesting thought process. But, then it comes to delivery charges and cost of fuel and all the other things. And oftentimes mail order pharmacy, like they feel like there's a real block in care because mail order can't fulfill some of these urgent needs, as easily. And this might be something that could solve a little bit of that. What do you think, bud?
Yeah, absolutely. Imagine it that you're in the doctor's office, right? Maybe you got the flu and you're going to get some medication for the flu, right? Instead of having to then go to CVS or rely on somebody to go to CVS, Walgreens, a retail pharmacy, and dropping off a waiter, right? Like, I'm really sick. I got to wait 15 minutes. And of course, we know right now retail pharmacies, they're pretty backed up, right? The volume is just insane. What they're being asked to do is insane for their workload. How long are you waiting for that, right? And then you're waiting at CVS and then or retail pharmacy and then going home. And this just, you're right, it expedites the process, or it has the ability to expedite the process. And it's a really big driver of convenience. Now, on the other side of this, where I really like kind of where this is going, is it allows more people access to these medications and that they're going to be delivered to their house, which then does what? It alleviates retail pharmacies from that volume, right? And maybe, retail pharmacies will get into this as well, the big chains, right? And they'll be able to deliver it with this. And then it just kind of alleviates that, a lot of consuming of these people that are just going into retail, right? Going through the drive-through, going through the the registers, and kind of spreading them thin. So I think it has a lot of impact and potential good impact there as well.
So, go ahead.
Go ahead.
I was going to go to a negative, but then I was like, no, we're focusing on the positives right now.
The only thing I was just going to level set real quickly is I feel like sometimes we hear about some of these like next steps and things going on, and we think this is space age. There's nothing like this that's out there. But let's not forget there are things that are already out there that are very similar when it comes to even medication delivery. And no, they are not mobile. But the fact that we already have medication kiosks that are currently available, I was going to pull up a picture so some folks could see like some examples. Let's see here. I'll add this to the stage. So you guys can see that these kiosks are already up and available for individuals to be able to take their medications from. And so no, they're not in flight, and no, they're not mobile, but they already have the ability for someone to, without human intervention, and the human intervention that occurs is not direct human intervention, it's via a tele-like intervention. They can procure their medications from some of these, individual units. And so it's not as wild as we might think when it comes to this ability to pull medications from a locked cabinet, type of setting. And then, looking at something like this that Amazon Prime Air is kind of looking at, having a key or a locking mechanism and multiple cameras to be able to identify an individual or a user that's allowed to take these things out of it, gives that additional level of security. I will be really curious, Zane and Chris, and we'll switch over to, let's do legal first. I'll be really curious to hear how we start approaching it from a legal aspect when it comes to this kind of delivery and what kind of safety mechanisms have to go in place. What are your guys' thoughts already on how we could deliver some of these things from a legal standpoint to be able to abide by state like pharmacy regs?
I mean, I think that I think it would probably mimic what we do with mail order right now, right? I mean, they call you and they ask you what days are the best days, what time's the best, will you be there? Are you authorized? We usually want a signature because the cost of medication, but if you're authorizing it to not be a signature, you're taking on risk. I think all that legal stuff has already been laid out for mail order pharmacy. And I think it would be the same boilerplate things that would be used for this. It's no, I mean, I know it's oversimplifying, but it's honestly no different than just a mail order pharmacy.
Totally agree. What other negatives are you seeing, Bud, or thinking about when it comes to this kind of delivery process?
All right. So I want to preface all of this by saying I do think this is a really good idea. Like, I really do. But kind of to Chris's point, I don't, and Chris, please don't, I'm just going to push back on a little bit on what you said. Yeah. I don't think it's going to alleviate, because to alleviate the retail pharmacy, the load of the retail pharmacy, you need so many drones. So, like just that upfront cost of these drones is going to be so high. Then we're not even talking about noise pollution. These drones are really, really, really loud. If anyone's been, I'm not talking about these small like DJI with 4 things. These have like 6, 7 propellers, and it's really loud. So just noise pollution is another thing that I don't think a lot of people like. I think a combination of the drone and those those cabinets is the perfect solution. I think those cabinets have would do more for reducing volume, because you can have a cabinet that can hold 30, 40 scripts, right? And you can have one drone, a handful of drones that go out in like whatever radius you have, like 4, 3, whatever mile radius you have, that can go out and for special things, right? Where a patient can request it. Otherwise, I think the hybrid system is the way to go. And then the other thing with the drones is a lot of these retail pharmacies, they rely on the reason why, I'm sure it's not a shock to most people, the reason why pharmacies are all the way in the back of a store is so you walk through all the aisles, you can pick up things as you go, right? And I think that there's been a reason why, pharmacies have been kind of slow to move. These bigger chain pharmacies have been slow outside of when they have a PBM, but until they got PBMs and the specialty pharmacies and all that stuff, like the mail order pharmacy was not a thing for them, because they were literally cannibalizing their own business, because you're not coming into the store, you're not buying all those other random things as well. So those are just kind of the things that were kind of going through my head. But I think the technology is good. It will definitely help a lot, but I think you can't overlook all of those things.
Yeah. So Chris, what are your thoughts on, I guess, both what Zane was saying there and any other negatives that you think could be and or result from utilizing this kind of delivery mechanism?
Yeah, first I'll touch on what Zane said, and yeah, he makes a lot of good points, right? Lots of good points there. But I think if there's anybody that can do this, it is Amazon, right? And how they can scale, right? And you look at how they're able to scale existing things already. They'll probably get drones and they'll probably make them more efficient, less noisy, over time, right? I mean, it's from now until 30 years, 20 years from now, right? They've got time to keep working on these iterative processes, time to make these drones, cheaper. And maybe at one point they'll have technology where they can deliver multiple, deliveries at one time, right? So not just a single delivery to one, right? But the negatives, Kevin, you touched on it, right? Security. How secure can we make it? We do have good things right now with mail order, but when it comes to controlled substance medications already, is there any kind of risk there, right? Where, if you know somebody is, if your neighbors are there, or people that know somebody's getting like controlled substance pain medications every week, right? Are they gonna catch on to that and then see them kind of get their drop off or their medications dropped off and kind of go from there, right? So how do we make that a little bit more secure in that aspect?
Yeah, I think it's fascinating because that to leverage a technology like this, a delivery technology, it can't be just used for one thing, right? It has to be expanded across kind of the entire delivery mechanism, just like all of the other freight and other shipments that would go about it. But I do really like what you're both saying there when it comes to delivering multiple and doing a hybrid model, as Zane was talking about, because I do think there's some potential for a drone to be able to carry multiple prescription bags right inside of them, drop them off to a qualified professional to be able to load up, what would be a kiosk for that kind of component of having multiple meds being picked up in one location and verified and certified, and then being dropped off and put into a verifiable and certifiable location for them to be procured by the patients or dispensed, which I think is a really interesting model. I think the more like far-reaching one though is literally it's dropped off at your door. I think that's what the news buzz is about. But Zane talked about the buzz, like they're not quiet, and getting those into individual communities. I think that would be one of the bigger negatives for me is just where are you going to have these units land and how often, how many are going to work? Me living out in the country, having one drone drop off, in my 10-acre little spot. Hey, great. Somebody living in the suburbs when you're on less than a quarter of acre or a tenth of an acre, or in apartment complexes, now that becomes more problematic, and how do you start working within those like individual city confines and the construction of how people are living. So I think those are some interesting negatives or at least hurdles to be able to jump over. The other things that I'm really curious about from your guys' perspectives is exactly what you guys have brought up with mail order. So one big problem with mail order that mail orders have gotten in trouble with a few times is one, lack of pharmacist interaction, lack of clinical consulting or counseling with it, right? And the other one is safety of those individual meds that are being moved from one location to another. Are they doing temperature excursions and going out of temperature range? How long is it taking them to get from one place to the other? What are you guys' thoughts on some of those things that could potentially be improved using a system like this? Zane?
I mean, a system like, so this is like where I think drones would be great for, where you have like those medications that have to be within a specific temperature range, right? You can't have it sitting out for 10, 12 hours, right? You can't worry about all of that. Like you need it at the doorstep. They're high cost medications. So I think those are the kind of instances where drones would be amazing for. Like, I don't think we can use it for every single thing, because if you are going to that model, you need a lot of mini distribution centers all over the place, because these can only go a certain distance. But getting those like specialty meds into the patient's hands, you can also be like, hey, because with deliveries, like with mail orders, with delivery things, and if anyone's got anything delivered, they'll tell you a day, right? You could theoretically tell a person like, we will be there at 7:45 a.m. Just be out at the door or be around, right? So like you can combat some of that stuff that's a problem with mail order. But to your point of patient interaction and this and that, and this is kind of going off the rails, so just this is just the way my brain works, guys. But what about like mobile pharmacies, right? Like you already have this infrastructure of delivery drivers and so on and other things, right? you know, you could set up like appointments, and the pharmacist doesn't necessarily have to be there, but like, you know, you can have like a laptop or some sort of like video thing that you can bring us, the pharmacist, to the patient. But that can be a topic for another thing. I just thought of that when you asked that question. But I think that's where drones can be amazing at, is just that quick, instant, like, hey, I need, you know, we'll be there at 12:01 p.m., you know, during your lunch break. You schedule it, you're there, done. Boom, you get your medication, you head out.
I love it. Chris, anything to add to that, buddy?
Yeah, you know, I think Zane hit it right on the nail, right? I think for temperature excursions, I think drones are the way to go, right? We, you know, even in home infusion, you know, they're used to doing UPS, FedEx, and there's certain packing that they can do with ice packs to get temperature, you know, to make sure the medication doesn't go out of range on a temperature. As far as the clinical aspect goes, you know, I did think about that too when I said it, right? With less people going to retail, getting counseled. But I really think that's where, you know, the pharmacists at Amazon or whatever company that does this, right? They know which patients are getting prescriptions for the first time and what scripts are getting for the first time, right? So is there a possibility that they could reach out telehealth or by phone communication, right? And just to make sure, hey, is everything okay? Do you have any questions? Here are some counseling points, right? Now, the hard part about that is, you know, how do they make sure that the other end picks up the phone, right? And then is there a way they can do some kind of secure text messaging with that or something with the app, right? For counseling points as well. But yeah,
I think there's some technology can definitely be leveraged in there for sure. We did have one of our listeners or watchers, I guess, comment and say, this is really cool. There was an article out of Rwanda that looks like they're using drones to deliver like blood supplies, which that's genius. I mean, I think it makes a ton of sense when there's some emergency components to be able to pull that in, or if you just need to share blood supply amongst multiple locations because of shortages. I think that's perfect. Here's the next negative I want to bring you guys kind of into. How do you think it impacts our profession? Do you think that this kind of delivery mechanism is going to be positive for individual pharmacist employment, for fulfillment kind of components? Because I think it does expand the reach of potential mail order into communities even further than just they can only do chronic drugs. Because now with this ability, they could potentially do acute medications as well and fulfill those. And the second one is related to independent pharmacies. Do you think this is going to be something that is going to be another negative for independent pharmacies, that now there's these large competitors that can have drone delivery potentially offered, and is going to be more difficult? Or do you think there's some advantages to both our profession and the independent pharmacy community? Zane, you first.
Yeah, I mean, and also one other positive, kind of to Chris's point, the extrusion, like there's so much packing material, like you could theoretically save a lot of wasted packaging material. Just want to bring that up because that's something that people don't think about when they're delivering meds. But anyways, I kind of will take I think this could work great for independent pharmacies, because then this gives them a leg up, right? Because you're able to expand your reach with this, right? This is this is taking the price of the drone out, right? Like, I'm not talking about that, but you know, if you can market it enough, I think it could be a great thing, right? Because you don't have the manpower to deliver. Like with a drone, you can program it or whatever. I don't really know the exact. I'm sure that they program. I'm sure that the Amazon people are like, oh, we're gonna have like 300 people just like driving drones around. But I mean, there's that aspect of it. So I think independent pharmacies, if they do it right, could actually benefit from this a lot, because I think the more and more, and this is now going to the first part of your question about the profession, I think the more and more we're automating things, people are going to start, maybe people don't believe me, but I think people will start craving that personal touch. And I think that's where independent pharmacies could really thrive. And that's why I thought of the idea of the mobile pharmacy, right? Like you already have this delivery infrastructure, right? Why don't you add that pharmacist, just bring us to you, right? Obviously there's a lot more logistical things that you need from that, but I think there is a chance. I mean, it can go either way, and I think it's about it. But the thing is, we have to be the ones that really implement it and implement in a way where it benefits us, not in the sense of us as the profession, but us as a thing. Like, benefit if we're able to reach our patients and counsel them properly, that's only going to help the patients. And I think us as pharmacists have to kind of think outside the box a little bit. And also, I think asynchronous care is going to be something that, if I was in this position, I would push asynchronous care, right? Everyone knows that I love drip campaigns, and I think they should be in healthcare, and this would be a great way of doing it, right? You can tell them before their delivery, like, hey, you're going to get X medication delivered. This is what it's for. They get their delivery. Hey, did you get your delivery? Just making sure it says you got it. Great. And then, you can just have multiple touch points over and over again, rather than that one, like 30-second, 1 minute encounter. So I think it could be a positive if we make it into a positive, but it's just like, what you don't want is, okay, this is happening. Oh, well, I guess that's another thing gone. I think that will hurt definitely. But, I think there's a lot of things out there that we can use to make the process even better than it is now, to be honest with you.
Okay. Interesting. I like that. Chris, what about you, buddy? What do you think?
Yeah, for a profession, right, it really moves us, or it has the potential to move us from being kind of volume-based to filling prescriptions-based, right, to us providing more value in other ways, right? Maybe some value-based care metrics can play a huge role here. But really, that's for us to figure out, right? Like, what else can pharmacists do besides dispense? And of course, the answer is a lot, right? So does it help the organization, or does it help the profession? I think it really does, because I think it allows pharmacists to become more innovative and become more entrenched into healthcare in different areas, right? It forces us to think outside the box. And sometimes that's a good thing. For independence, is it good or bad? For overwhelming the patients that want kind of that personalized relationship, I think independents are safe there, right? But the one thing that, we know about healthcare, we know about patients, we know about people in general, is they love convenience, right? Amazon is Amazon because of the convenience that they have, right? It's the Amazon touch. So I think that's going to be a potential negative for independent pharmacies, just because of the convenience. You look at Blockbuster, right? And Netflix, they never thought it would work. And look what happened now, right? There's one Blockbuster remaining, based purely on novelty, right? So yeah, I think it's going to be tough for independents on that. They're going to have to look for other ways to kind of be successful too, not just filling prescriptions as well, not volume based.
Yeah. I do want to step in and lift the independence up a little bit, but in the sense that I think independence, if you're an independent pharmacy, this is coming. Yes. You can be scared of it, or you can embrace it. So you don't have to embrace the drone thing, but I think you can embrace other technologies. Like I said, async care, telehealth, all these things. Like, yeah, you may not be getting paid for it, but you can automate it to a certain point to where you can keep the because the thing with technology is, I think what people fail to realize is, not is it only convenient. Convenience is one thing, but then you can also multiply yourself. So I think that's how we need to start thinking is, okay, yes, the convenience factor is going to start taking things away. Okay, but how do we use technology to multiply ourselves and be able to increase the touch points now? Okay, fine. Now we have a little bit more time or whatever, but let's figure out ways to increase the touch points. So they're always thinking about the pharmacist. They're always thinking about, hey, the pharmacist is going to reach out to me. The pharmacist is going to do this. Oh, I just got a message from the pharmacist the other day. He was checking out. They were checking. It might not be physically you. It could be like an automated message or whatever. But it's just about retraining the patient, right? Retraining them to more than like, hey, the pharmacist is just that dude in the white coat that's just, putting pills in a bottle, right? No, we're more than that. And we need to prove that we're more than that. I mean, we can't just sit in there like, oh, hey, we're technically a doctor, but we know all this stuff. But what do we actually show the world that what we do, right? We don't really show them anything, right? So I think this is the opportunity that we need to take to say, hey, this is what we can do, and this is how we can do it. And it's up to us to do it. We can't wait for the AMA or this and that or the government or whatever. Like, we have to start doing it on our own. And that's the thing I think with the pharmacy profession is we just have this defeatist attitude, and we're like, oh, well, oh man, we can't, we're not doctors, we're not this, we can't step on this person's toes. We can't, no, screw all that. In the end, it's just what is best for the patient. Yeah. And when it comes to medications, our involvement is what is best for the patient. Literally hundreds of papers out there that prove this to be the fact. And we save millions of dollars. Like, I think we need to stop this, oh shucks. Like, stop this, guys. Like, we can make it happen. It's just a matter of, like Chris said, we need to think outside the box and just do things a little differently than they happen.
Yeah. And just because, we don't have, if we do the convenience factor and we do drone shipping, that doesn't mean we don't have to stop being the most accessible healthcare provider, right? We can still be accessible in other areas like virtual care.
No, I totally agree, and no aw shucks for me, Zane, on that one. The aw shucks is really we didn't get to our printer stuff, which makes a ton of sense. So guess what? You guys get 3D printing next time, and we'll talk about that. Come prepped and excited for all the things there. Hope you enjoyed the episode on Amazon shipping components and adding on drones. It will definitely force some hands on different ways to think about drug delivery. So everybody, have a wonderful rest of the day. Chris and Zane, like always, pleasure, man.
Nice.
Nice.
Yes.